So Botox has revolutionized the cosmetic, practice that I've been doing for 25 years. I remember starting injecting Botox back in 1996. That was about 25 years ago. And Botox is a remarkable treatment for getting rid of what we call dynamic wrinkles. Dynamic wrinkles really means wrinkles that are really not there at rest, but they develop as we express ourselves. So we're talking about these frown lines between the eyebrows, forehead creases as we move our eyebrows up and down, crow's feet from smiling. Once those lines are really etched in, Botox is not necessarily the best option. We resort to fillers, but Botox does an incredible job of just smoothing those lines from expression. It is a purified protein, as you know, is what we call a neuromodulator, and it is extremely safe. It's injected right up below the skin where the muscles are, and it basically relaxes those muscles. And once those muscles are relaxed, they're no longer pulling and creating tension on the skin. So as a result, the skin over those muscles actually relax. The key with Botox is really about knowing the facial anatomy. It's about really knowing how many units of Botox to put in, where to put it, where to do it, where not to do it. And when injected properly at the right concentration, it works beautifully to just create a smooth expression. Typically Botox in my hands lasts about 4 to 5 months because I'm one about making sure we put the right amount so that patients experience longevity of Botox. And it's also about really knowing where to avoid. Sometimes in some people we avoid the forehead because if you relax those muscles, you can actually get what we call browtosis, which is depression of those eyebrows. It's all about movement in a way where people look more rejuvenated. They look a better version of themselves. So it's important to really seek someone who knows where to inject, how much to inject. More advanced areas are bunny lines. We can actually fix crooked smiles. I can slim the face in people who have what we call masseter hypertrophy due to clenching their teeth and where the muscles kind of bulge out. We can help relieve really TMJ issues in people, again, who are clenching. We can really help improve the neck in people who are beginning to get necklines or banding. Again, muscle relaxes those lines. And then more advanced areas are people who have downward pull on the corners of their mouth. We can inject certain muscles that actually stop their action that are pulling down. So as a result, the corners kind of flip up. So we can do what's called the lip flip. And there's really a lot of uses. We can actually use it for hyperhidrosis, excessive sweating of the palms, soles, although we do mirror dry, which is more permanent. So Botox has just so many uses. It's one of my favorite procedures to do because I know the facial anatomy. Thank you.